This video will show you how to measure blood pressure with a manual sphygmomanometer. This set of apparatus is a sphygmomanometer which is used to take blood pressure manually. There is the blood pressure cuff, the pump, the pressure release valve, and the calibrated manometer. Before you start, make sure you check the apparatus to ensure that the cuff is deflated and the error on the dial is at 0. The apparatus in general should be in good condition and there shouldn't be any tears or loose connections. In preparation, make sure you sit your patient relaxed for 3 to 5 minutes. Their arms should be relaxed, supported at the level of the heart, and the upper arm should be exposed. Firstly, you need to find the brachial artery. The easiest way to do this is by bending the patient's arm to find the bicep tendon, then moving 2 centimeters medially to the position of the brachial artery where you will feel a pulse. On the cuff, there is an arrow saying artery, and you should put this at the position of the brachial artery. Wrap the cuff around the arm, keeping it snug but not too tight. Make sure the knob on the pump is twisted clockwise to make sure no air can get out when you pump it. Now we need to estimate the systolic pressure by palpation. We need to find the radial pulse, which is located just here. When measuring the radial pulse, always use your fingers, not your thumb. Hold the pump in a comfortable position, then inflate the cuff until the radial pulse disappears. Now slowly deflate the cuff by twisting the knob counterclockwise, reducing the pressure gradually at a rate of 2 to 3 millimeters of mercury per second. The pressure at which the pulse reappears is an approximation of the systolic pressure. The next stage is measurement of the systolic and diastolic pressures by auscultation. Fit the stethoscope in your ears with the earpieces pointing slightly forward. On the stethoscope, there is the diaphragm, which is the bigger side, and the bell, which is the smaller side. Twist the end of the stethoscope to ensure you are on the diaphragm. You can check that you are on the diaphragm by tapping both sides, and the diaphragm should make a louder noise. Then place the diaphragm of the stethoscope at the location of the brachial artery. Twist the knob of the pump clockwise so no air can get out. Pump the cuff up to 20 to 30 millimeters of mercury above the estimated systolic pressure by palpation to occlude the pulse. At this point, you shouldn't be able to hear anything. Then, like before, turn the knob on the pump counterclockwise to let the air out slowly. Let the pressure fall slowly at a rate of around 2 millimeters of mercury per second. As the pressure gets closer to the estimated systolic pressure, you should listen out for the start of the Korotkov sounds. These will be explained properly later, but they are a beating noise which can be heard now. Make a note of the pressure when you first hear the Korotkov sounds, as this is the systolic pressure, and when they disappear, as this will be your diastolic pressure. If in an OSCE, then give your systolic and diastolic pressures to the examiner, but make sure you always give the units. And whenever with a patient, be it in an OSCE or in real life, remember always to use your communication skills throughout to make the patient feel comfortable. Korotkov sounds are the beating sounds mentioned previously, which is the blood flowing through the brachial artery. There are 5 different phases. Phase 1 is a tapping sound of increasing volume, which you can hear now. Phase 2 is a soft swishing sound, which you can hear now. Phase 3 is a crisp thudding sound, which you can hear now. Phase 4 is a blowing sound, which is quite muffled. And finally, phase 5 is silence. Sometimes with hypertension, an auscultatory gap occurs. This is when the Korotkov sounds disappear, usually in phase 2, but may reappear as you get closer to the diastolic pressure. This is why it is important to check the systolic pressure by palpation. Thank you for watching. I hope you gained a greater understanding about how to manually take blood pressure and the associated crotch cough sounds.